Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guest is Dr. Dan Cardellichio, who is a chiropractic physician and holds an MS degree in human nutrition from the University of Bridgeport, where he serves as an adjunct professor. Dr. Dan is passionate about transforming our broken disease-focused system to a true healthcare system, finding the true root cause of all diseases. Dr. Dan had a heart attack at the age of 37, and since that time, he's dedicated his life's work to helping those restore balance in their life. Dr. Dan works with individuals with metabolic dysregulation, such as heart disease, diabetes, and metabolic syndrome. Dr. Dan has become a leader and educator in the field of metabolic nutrition and functional biochemistry. He uses state-of-the-art diagnostic testing, and his clinical experience is used to help determine the cause of your condition and the best course of action for his patients. Dr. Cardellichio is a dynamic, energetic, captivating, and thought-provoking speaker. He looks forward to meeting you to discuss your nutritional needs. Welcome to the show, Dr. Dan.
Thank you very much. It's an honor and a pleasure to be here. Usually I am the one that's doing the interviewing. However, I'm getting interviewed more, so it's always interesting. So if I start interviewing you at one point during the conversation, tell me to stop, okay?
We'll flip it around, yeah.
Yeah.
I'm going to call you Dr. Dan because your last name's, hopefully I said it right.
It's definitely a mouthful. Yeah, it was very good. It was very good.
Well, tell us your story. Your bio is very interesting. Obviously, you had a heart attack very early in life, which has fueled your passion. So let's start with your story. Kind of tell us about that and how you got so interested in functional medicine.
So I'm a chiropractor by trade, and I'm one of those, type AAA driven type of individuals. And when I had graduated from chiropractic school, I wanted to set the world on fire. And I just had these grand goals of having practices with medical doctors, physiatrists, anesthesiologists, orthopedic surgeons, physical therapy. And that's exactly what we did. And we did this in 3 different states: New Jersey, New York, and Connecticut. So my partners and I, we set these up, and we were serving humankind. And when you're serving at a high level, money is coming in and so forth. And we got to be very successful in helping patients and as well as monetarily. And what happened is that now I'm traveling to 3 different states from northern New Jersey, and it was very stressful. And your lifestyle changes. You get married. You get that, first year 10 pounds when you get married, and I just gained in a 6-year period of time from traveling from office to office. I gained like 60 pounds. So maybe 70 pounds. I think I was like 260, and healthcare was changing. There was a lot of stress running big practices. We had over 100 employees, and it became very stressful.
Yeah.
For breakfast, lunch, and dinner, I was eating out, whatever fast food restaurant was there. I was not exercising. I was not taking care of myself. And I went to the doctors. He said, "You got a little bit of blood pressure. Why don't you just, watch your stress?" All I know, Stephanie, is that at one point in time, I remember being in the office on a Tuesday, and I started blacking out. And I remember getting tunnel vision, and I equated, and you're dehydrated, and you get that tunnel vision, and you're kind of blacking out. And there was a hospital right across the street from me. And I went into the hospital, and there was a doctor, an orthopedic surgeon, just happened to be there, and he looked at me, and I referred cases over to him, and he says, "Dan, you're going to die." I don't remember checking in. All I remember is lying down, and they had the pads, they had the nitric oxide paste. My blood pressure was 230 over 120-ish.
Wow.
And to me, you do feel it on the left side of your face, in your jaw. And it was like a marble going down a blood vessel. I felt like a marble, and it stopped in my shoulder, and I passed out. And I awoke, and they said I had this mild heart attack. And I just kind of looked down, and I looked at my stomach, and I said, "Wow." I said, "This is not happy." And follow-up visits, my cholesterol was a little bit over 500. My triglycerides were 1,227. and most people don't survive. And this is how I got involved into functional medicine. Listen, I'm not anti-medicine. I needed to take Tricor. I needed to take Lipitor at that point, right?
Sure.
I got to get that down. I remember saying to my primary care, I'm going to go run. He says, "You're not running." He goes, "You're going to die if you run." He said, "You're going to walk a little bit." And I found a functional medicine doctor, and I had no idea exactly what that was.
That
But
was
we
a
did
long
some,
time ago too. You look great. I'm
yes.
not saying you're old. I'm just saying like you were only
Well, I am a
35.
little bit,
Yeah.
Stephanie.
Older than me. I'll say you're older than me. So back then I imagine there really weren't they weren't as prevalent as they are now.
No.
So
And the functional medicine doc was a chiropractic friend of mine who has a master's degree in nutrition. And he ordered some of the interesting blood work of the day. And he sat me down. He went through all of this. He changed my entire life. He changed my entire life. And this is how I got into this. He looked at me and he says, "You're really into this. Go for a master's in nutrition. You can do this in your office." That's what I did. I didn't see him for 3 years. And I just started eating appropriately. I was taking targeted nutrition supplements. The weight went down, and I'm 60. I'm going to be 61 in a couple of months, and I can keep up with my son in the gym on most exercises, not all. And this is how I got into it. And it's really a game changer. I just love being a functional medicine physician.
awesome, awesome. I want to ask back then, I kind of have my own story. We all do, right? I had my
Right.
own kind of personal health crisis. I had tachycardia, very fast heart rate, and I
Mhm.
was very stressed out also. I only had 10 employees, not 100, but that was stressful enough. But
Yes,
but
it is.
looking back now, that was years ago, right? But looking back now, I can see how my body was probably sending me signals, but I was,
Yes.
so I would guess my question is, was your body sending you signals? You mentioned you had put on some weight, right? But in the moment, I was clearly blind to those. I was just all, full speed ahead, just keep doing what you're doing. You're getting through your day. Like, look,
That is a great question. That is a really interesting question, because I will tell you, the month leading up to the heart attack, I knew I was having a heart attack. I knew it. I couldn't stop myself, though.
mm,
I was addicted to food. I was addicted to fast foods, to processed foods, to all of that stuff that you and I talk about
mhm.
to our patients now. I couldn't stop it. I mean, I remember driving home, and for those of you listening from New Jersey, on Route 9 South, and I pull into a fast food place and I get a burger and I get large fries and a sugary cola. And I took one bite and I threw everything out the window because I said, "I'm going to have a heart attack." And I felt myself. Your hands were clammy. My
Mm,
face was white. I was sweating. I would wake up in the morning and my heart was pounding. And, it was a struggle literally to walk upstairs. I was like out of breath. I'm sitting there saying to myself, I ran marathons. I played football, right? I played basketball, high school, college things. And, I'm having a difficult time. I mean, I remember one time, literally, I'm watching TV, and I used to have cereal at like 10 o'clock, 11 o'clock, because now I'm starving again. And I have a box of cereal. And then to walk up the stairs, and my head I'm dizzy, and I'm having difficulty breathing. And I said, "This is not the way it should be." I'm a healthcare provider, right?
right, right. But sometimes healthcare providers, I mean, I remember working in the hospital. One day I kind of looked around and I'm like, most all these nurses are significantly overweight. Like, what is
Mhm.
healthcare turning into? Like, what is it turning into? It's not a healthcare model. And yeah,
You know
without,
what? It is a sick care model that we're into, and it's a situation where we look at symptoms. It's a situation where we're looking for entities to help us, and that model is not working. So you and I are kind of disrupting that model a little
Mhm.
bit, or a lot of it, because I think that that is not the way healthcare should be. Don't look to something on the outside. Don't look to whatever. I mean, mutual friends, and they would sit there and say to you, "Oh, you're going to use your insurance company and you're going to have your insurance company dictate your health." No, that's the worst possible thing you can possibly do in your life. But we've become accustomed to this, right? We've become accustomed, a cup of coffee, right? You're in, maybe you're doing a shift and it's 10 o'clock at night, cup of coffee, a little cake to get you through the next 3 hours. 5 o'clock was coffee and cake for me in my office. The secretaries would just make a little coffee. They had a little cake. And I go in, a couple of bites, a little bit, then you go see patients, and then you just go, no, it's not a lifestyle that is smart.
I think a lot of individuals maybe feel lost also, and that they maybe don't even know functional medicine exists. Like, you knew something's wrong, I'm going to go seek out and find a functional medicine doctor who clearly helped you.
Right.
But I think a lot of individuals are not aware that functional medicine even exists. So I actually want to stay maybe on the topic of heart disease, metabolic syndrome here for a moment. I want to get into gut health practices, whatnot, but since you're just sharing your story about heart disease, do you want to share some of the functional lab tests? Actually, and I don't even know back then if advanced lipid testing was available or whatnot, but can you share for our listeners? Yeah,
it wasn't exactly available, but listen, you know what? I think that for you and I, the functional lab testing is the game changer in combination with traditional blood work, right? And if you're going to do an advanced lipid test, and it's really an interesting situation because everybody talks about cholesterol, right? And cholesterol has some positive aspects to it, right? It's good for hormone balancing and development. But I like to do the advanced testing, and I like to, add in what we call a big word, apolipoproteins, right? There's A1 and B, and we take a look at these, and it's a situation where we're looking at inflammation in the body. The ApoB is the bad cholesterol, and we want to make sure that we're working on that. It includes LDLs, it includes the very low density lipoproteins, the VLDL. And when those are high, we want to do strategies. We have strategies to help bring that down. Apolipoprotein A1, good cholesterol. It's cardioprotective. We want to make sure that we're raising that up. I like to do that. I like to do inflammatory biomarkers. I like to do the C-reactive protein. It just gives a very overall picture of inflammation in your body. It could be coming from your food, from your stress, your diet, your lifestyle. Those are the ones I like to do. And I like, what? The other one I like to do is the omega-6 to the omega-3 ratio. I love that one. I really like that a lot. Arachidonic to EPA. So omega, we all hear about omega-3s and omega-6s. Omega-3s are good, and they have this anti-inflammatory effect, and we want to make sure that we have a proper proportion of the omega-3s to the omega-6s, should be 1-to-1. But in today's society, it's 15-to-1, where we're eating the inflammatory foods, the processed foods, the ultra-processed foods. And those are high in omega-6s, which increases the inflammation in the body. That's a root cause right there, is looking at that inflammation in the body. So people are just eating junk food. I don't like that term. It's either junk or food, So, what we're coming out of over the last 2 years, so many people were eating the cakes, the candies, and things of that nature. And that's all omega-6 fatty acids, which increases inflammation in the body. And that just sets the whole situation up. That just sets everything. That's like a root cause. And now everything starts falling apart from there. Takes a period of time, right? It takes a period of time. But if that's your lifestyle, that's what you're doing habitually. So I love those advanced lipid panels because it gives so much great information to help treat and to sit there and say, okay, now we need to do X, Y, and Z when it comes to that.
Because some patients, a lot of patients who seek me out, at least, and maybe you too, they want to avoid statin medications or just medications in general, but we have to assess their personal risk, right? So by not just looking at a lipid panel that their doctor said, they need medication for, we can look beyond that to see kind of what you were saying, the particle sizes, to see how inflamed they are. We can see if they're building plaque. We can see if the cholesterol is oxidized. And I think a lot of patients
don't
realize
oxidized
those tests,
LDL, right?
are available, but they are available, and we can use them to then
They
personalize, yeah,
right.
their care.
They
Yep.
exist, and then what you and I do is we put together that program based upon that blood work. Listen, as I said, I'm not anti-medication. If a patient comes into me and I run, just a regular lipid panel and the triglycerides are 800, I am going to refer them to you so that you can further assess them. And maybe they do need some medication at that point to help bring it down. But let's also get you off of that medication, and let's also take a look at your lifestyle, right? And let's take a look and how can we get you off of that medication? What are you doing to bring this about?
Hmm.
Because I'm sure you find the same thing. And when I teach at Bridgeport for the graduate program in human nutrition, and I always say this, it's a situation. If you're eating poorly, you're smoking generally. And if you're smoking generally you don't have any exercise. If you're not exercising, generally you are, drinking a little bit too much and you're eating poorly. Maybe Friday nights kind of going to the bar and you have a hamburger, you get a double bacon cheeseburger and you're having a couple of drinks, and next day you get up, you don't feel good. Now you have to have a little coffee, a little sugar to
Hmm.
settle it. And then you're going to have some, I don't know, some type of donut or whatever. That's very normal for individuals. And I find that those individuals, they don't drink a can of sugary soda or an iced tea because it's made from the best stuff on earth, of course, right? Remember that commercial? They're having a dozen of those in a day. That's bad. So all of this blood work
Right.
helps out with all of this.
I totally agree. And I want to go back to those inflammatory oils. So I mentioned to you before we started the interview, I'm from Iowa. And so soy and corn are, on my right and left hand side everywhere I'm driving. Like those are in everything. Literally, I took
Yes.
my son to a pumpkin patch because we're kind of around the holiday season here. And
Mhm,
the man who owned the pumpkin patch said, this is corn. Corn is
mhm.
in everything. Like he was
Yes.
proud that corn is in everything. And I'm thinking, no, this is not good. High fructose corn syrup is in everything. Yes, I see you're proud of that, but that's not healthy. And it's also, I think, very addictive.
Yes.
So individuals, like you said, who are living this lifestyle with these bad habits, those habits are hard to break. And I
They
get that.
they are.
That's, yeah.
There was a study done in 2016. I think it was New England Journal of Medicine, and it indicated that corn, wheat, and soy, they're fillers. They're using them for fillers. And 53% of Americans that consume this, I think it was like 35 or 33 to 35% of those are in excess, and they have high lipid markers. They have high waist to hip ratio, which is bad. And they have pre-diabetes. I don't know what pre-diabetes is, to be honest with you. You're either diabetic or not, as far as I'm concerned. They have all of this metabolic dysregulation going on. And when you're cooking with these oils, another interesting fact is that if you cook at high temperatures, these oils become rancid,
Hmm.
right? They become very rancid. And we talked about the omegas. Now you got the omega 6s going on, which further increases the inflammation. It could be anything that you're cooking. I mean, we use oil for everything, right? So corn oils and soy, you know, maybe not the best. You got to take a look at that. And that's what you and I do. We'll take a look at that. How are you cooking? What does that look like? And what can we do to
Change it.
take that
Yes.
away from you, right?
Yes.
Right?
Yes.
And say, hey, listen, maybe you should try this instead of doing this. And, by golly, next thing you know it, 6 weeks goes by, you're down 12 to 15 pounds, you're looking good, you're feeling good, you ought to be in Hollywood, and you got more energy and you feel good and you look good. It's just a great way to serve humankind.
I want to go back. There's so many comments I want to make here. I do want to go back to how you mentioned corn, wheat, and soy, because I know there are tests to see if patients have sensitivities to those foods. But quickly, we do want patients to work to reduce omega 6s, in their life. but they need to increase the omega-3s as well. And we don't have
Hmm.
access to fresh fish. We live in Iowa, right? So eating fish isn't maybe as easy for those who are on the coast, whatnot. I mean, yes, you can still get some, but I heavily advocate, and I assume you probably do too, that patients supplement with omega-3 fatty acids. I mean, that's
Yes.
just almost a necessity for many of my patients. I've tested enough people's levels, and I know everybody needs more
Yes.
omega-3s. Yep.
It's important to supplement with the omega-3s. As a matter of fact, it's part of my core four: nutrition shake,
Mm-hmm.
vitamin D, multivitamin, and omega-3s. And that's important because it brings down that inflammation, because most people, it's not only in the United States too, most people around the world, have some type of health risk. Western Europe, they smoke. My cousins out there were smoking when they were 10 years old because that's just accepted. That's norm. And that creates inflammation in your body. So to take and to supplement is extremely important in order to bring
Mm-hmm.
down those inflammatory biomarkers, to get rid of that inflammation, and to start you on regulating your biochemistry in your body so that you're functioning better.
Mm-hmm.
That's the important aspect. Supplement is very important. That's why
Totally.
we run those panels. Sure.
Totally agree. And I do think we both agree that kind of inflammation is the root cause of all disease, and inflammation starts
Yes.
in the gut. So let's transition to talking about kind of
The gut.
what creates poor gut health.
Look to the gut. Excuse me. I tell all my students, look to the gut always first. So there's so many things that can create, a leaky gut, intestinal permeability, to could get in there and cause havoc in that gut. Stress. Right now,
Mhm.
everybody's stressed, right? Everybody's stressed out. Big contributing factor. Eating improper foods for you. You can tell me that you're eating the Mediterranean diet, arguably, right, one of the best diets that is out there. However, there may be components of that diet that may not work for your biochemistry. So we look at food sensitivities or food intolerances, environmental toxins, right? We're all exposed to environmental toxins. I'm in New Jersey. We were the chemical company of the world, pharmaceutical company of the world. We were exposed to dioxin. Agent Orange was made 2 miles away from me. So environmental toxins, pesticides, insecticides, herbicides, right? And you're in Iowa, so they may be using some of this
Oh yeah.
stuff
Yeah.
for harvesting and farming. Different medications can create this whole situation where your gut gets leaky. It literally gets leaky. So now when you're eating foods, you're not eating. If you have a slice of pizza with pepperoni, it's not that the pepperoni is going into your bloodstream directly, or the mozzarella cheese, but large proteins that are inflammatory are going into your bloodstream, creating that inflammatory process.
Mm-hmm.
So that's what causes this leaky gut. Very important to do today. Extremely important.
And I'm going to add to that gut infections. So you mentioned kind of food sensitivities or intolerances, environmental toxins, and then
Mhm.
gut infections. I would say those three by far
Yes.
are things that I'm sure we both assess with our patients. So let's break down the first. And did you know about food sensitivities back when you had your heart attack? Was that part of what your functional medicine provider helped
He
you with, kind of
did.
identifying what you needed to take out to reduce inflammation?
He did. It was very
Yeah.
rudimentary back then,
Sure,
the
sure.
food intolerance testing, but the technology has just come along so much, where the testing, one lab that I run is 206 or 203 different types of foods. We look at everything
Mm-hmm.
from salmon to mackerel to herring to beef to chicken to duck to all sorts of different fruits and veggies, that's causing an inflammatory response for you, because everybody is unique when
Mm-hmm.
it comes to this. And I think that's important to say. Everybody's different, because your food sensitivity is going to be different than mine, going to be different than your husband's, and so forth. So we want to find out what you should be eating and what you should be avoiding. And if we avoid those foods that are creating a food sensitive, creating this intolerance, creating inflammation, it's okay. So listen, salmon is a great source of omega-3 fatty acids. It may not be for you, but there's other sources of omega-3s that we can
Right.
get into your diet. via food or supplements, like we were talking before. So that's extremely important. That is in my practice, and I'm sure in your practice, it's one of the biggest game changers, because when you're putting together that diet, it's very specific, because you hear, oh, you should eat oatmeal for your cholesterol, or you should do this, or you should do that. Okay, that's nice, but it may not be good for you specifically, right?
Yep, agreed. Yep. It's a definitely way to personalize our approach, yeah, to patients' health. And I would say, regardless of what their symptoms are, whether it's metabolic disease, anxiety, acne, it doesn't really matter what their, the concern is they're coming in to see me with. Usually assessing gut health, like you're saying, everything starts in the gut, right?
Mhm.
Is very helpful. So
And that's great, because gut health, once you have this leaky gut, you're looking at, in part, metabolic dysregulation. You're looking at type 2 diabetes, you're looking at cardiovascular disease, weight loss resistance, hypertension. You're looking at autoimmune conditions, which can lead to skin types of conditions, acne, psoriasis, all of that. So
mhm,
skin conditions can happen, along with anxiety and depression. Along with anxiety and depression. Because how many times does somebody come into your office and they say, "Wow, my blood pressure's high, and my doc ran some panels, and I'm diabetic." There's always some anxiety and depression that's always
mhm,
associated. You find that? I
mhm,
find that. So those are some big conditions that can be helped along when it comes
mm,
to, looking at your gut. So I love
yep.
doing the gut testing.
Tell our listeners what lab you use. I believe you mentioned that you use Vibrant America. I know they have very specialized food testing. They have the Zoomer panels. Can you explain a little
Yes.
bit about how, I guess, specific, kind of how fancy those panels are?
Oh my goodness, they are very specific and very fancy. I could do a whole podcast on that. So let's take a look at something like the wheat zoomer test, right? Which specifically looks at leaky gut. So we're going to, run the panel, we get the results back, and it tells us whether you have leaky gut or not. It looks at different enzymes that are in the blood, right? So that, and different protein sources that are in the blood, because when you have a leaky gut, it literally separates the lining in your gut. And when it does that, enzymes and proteins go directly into your bloodstream. It's looking at those proteins and those enzymes to see if they're elevated, because if they're elevated, you have a leaky gut that's going on. And we need to, what we say, heal that gut. This is amazing. And this is how specific we get when we're looking at this, because then we can treat it in a very specific way. So there's different types of proteins and enzymes that get dumped into the blood, and we take a look at them, and we look at, they're elevated. It also takes it the next step. It looks at gluten, it looks at gliadin, which is the actual protein in gluten that causes that that gut distress, if you will, right? It'll tell me the different proteins in the gliadin that are high. Not just that gliadin is high, but all the subset of different proteins in there. I love this test.
I
It's
would say
it's
it's so fancy, it's much less likely to miss a wheat sensitivity or
you
gluten
you you
issue.
don't
Yeah.
miss anything, and it's like, you're sitting across from somebody and you say, "This is exactly what's going on." You could say it with virtually 100% confidence, if not 100% confidence, in how you can help out an individual.
Would you say that the majority of your patients you test do have problems with gluten?
Yes, they do.
Yep.
They do, because they're eating it all the time, and it's a very caustic compound, if you will, and it's a caustic food component that does create inflammation. Much debate on whether you should eat gluten or should. My patients, I'm running this test. They're getting better after
Hmm.
we give them the program of care, because we're looking at the gut. And yeah, I find that to be all the time, by the way,
Me
just
too.
about all the time, right?
Let's go on to looking for gut infections. So again, we kind of mentioned toxins, food sensitivities, and then gut infections can lead to this like leaky gut situation. So tell me what testing you offer for looking for just I guess, another glimpse into gut health and gut infections.
You know what? You want to do the stool analysis, right? Because you're doing the stool
Mm-hmm.
analysis all the time. There's many different testing stool analysis that you can do. It's going to give us the different bacteria that's in your gut, that's in your stool. Your stool is something, it's elimination. Everything is, it just runs through your body and it has that bacteria in there. So now we're taking a look at this and we're saying, okay, you have this bacteria high, this bacteria high, this bacteria that's high. Now what we're going to do is we're going to give you targeted supplementation, targeted nutrition to help further heal that gut, because it's all of it combined. And I think that's what is so great about functional medicine. You're looking at the root cause, right? And it's this is part of the puzzle, this is part of the puzzle, and this is part of the puzzle. It's never just one thing that's going on in your life. It's never one thing. I think it's a whole array of stuff, if you will. So doing stool analysis is another game changer to help out.
Yep. I think that's kind of where conventional medicine has it wrong also, and that at least in my book here, Your Longevity Blueprint, I kind of describe the fire department approach, where you needed the fire department approach when you had a heart attack. You needed them to put out your fire, right? But then long term, you need the carpenter or the contractor to help repair and rebuild the body, and that's kind of where functional medicine comes in. But I think with conventional medicine, many times patients are just seeing specialists. Their care is so fragmented, and no one's putting together, no one's connecting all the dots, that the gluten sensitivity could be causing the acne that you're seeing the dermatologist for, the bloating you're seeing the GI for, and the headache you're seeing the neurologist for. Those doctors aren't communicating, nor are they asking, what is the patient eating?
I mean, there's a perfect example, right? Where you can look at the gut for your acne. So you can go to the dermatologist. Maybe you're taking a medication for it, and maybe you're taking, an antibiotic, which is a very popular drug, pharmaceutical to prescribe for that. You're 14, 15 years old. Now your gut medications could cause this leaky gut. Antibiotics, right? Somebody goes on an antibiotic in my office, they're automatically taking a probiotic, all right, to replenish that gut, because that antibiotic is just not getting rid of the bad bacteria. It's also getting rid of the good bacteria, because it's important that you have good bacteria in your stomach, not the bad bacteria, but the antibiotic gets rid of all of them. It's not specific for that. And so that's extremely important, but there's no communication. My mother used to come from North Carolina up to our house at this time of the year and stay until Christmas. We go back to North Carolina. She would have 2 big plastic bags of medications that she would bring on the plane with her. The right hand didn't know what the left hand was doing. And then when she went to one doctor for this, and then the other doctor said, no, why are they giving you this? She's, she was in her 80s. She's not telling them the whole history that she doesn't remember. She's not even caring at that point, and it's very difficult. It's very difficult now because you're taking 20 different medications.
And all those medications deplete nutrients, which then leave you more nutritionally starved, and then you're tired. And
boy, I can go on for hours about that. So you get nutrient drug interactions. It depletes nutrients. If you deplete vitamin D, everybody's deficient in vitamin D. It helps out with your leaky gut. That's another avenue. I always do a vitamin and mineral panel at some point in time, right? To make sure there's no reason to take vitamin C if you're not deficient in vitamin C, right? You want to target what you're deficient in order to make your biochemistry work.
Absolutely. What are top nutrients you find patients commonly come back low in?
Oh, vitamin D, number one.
Yep.
Vitamin D is huge. Everybody should get out in the sun. You're in Iowa, I'm in New Jersey. We're not by the equator. I find, patients that are snowbirds that go down to, Miami for the winter in New Jersey, they come back. If I'm running the vitamin and mineral panel, sometimes it's still deficient, although
agreed. I have all these snowbirds who go to Arizona or Florida, and they're like, oh, I don't need to take my vitamin D because, and they're as tan can be, and they come back from down south and they're still low. So I say, you still have to take your
you still have to take your supplementation. Make sure you're taking vitamin D with vitamin K. how, what
Mhm.
are what is that, 5,000, 10,000? Because you
Mhm.
look at some of these guidelines and you're, 200 or, no, vitamin D is always number one. All right. Across the board. I find vitamin C is another one that people are deficient in. Just poor diets,
Sure.
breaking down. They just have vitamin C that there's a deficiency in B vitamins all
Mhm.
across the board. Those are the ones that I find. Do you have that very similar?
Oh, yeah, I was just thinking of the last few nutrient panels I was looking at yesterday, and
Mm,
I was thinking, what were the top? And I'm like, all these patients were low on everything. I mean, magnesium, they're just omega-3 fatty acids, they're low on
right,
antioxidants, they're just low on almost everything. I mean,
right.
even my patients, I've said this before in the podcast, but even my patients who are growing their own organic food, who are eating, I would say, relatively well, still need to supplement. It's very rare that I find someone in this day and age who doesn't have to supplement with something.
Supplement and listen, there's so much around supplementation, and we're not talking about going to a popular store and just patients come in, they're taking bee pollen. Well, why are you taking bee pollen? Well, I went to the store.
And I got
So
sold on the people.
I got sold on bee pollen or raspberry ketones or something along those lines. Oh, that's cute. That's nice. How much do you spend per month?
Yeah. If you want to save money, do the test, right, to see what you have needs for, and then you can supplement accordingly.
Because
And
you can have
yeah.
a $300 to $400 a month habit
Hmm. Hmm.
going to a popular vitamin store, right? I find that all the time in my
Hmm.
office. That's a lot
But
of money, people.
I like to, obviously, we're both are doing the same thing. I like to test patients, and then I tell them, hey, as you work to heal your gut, you may need to supplement a little bit less. So hopefully that's a motivation for them to eat clean and whatnot, and to take gut healing nutrients. So let's kind of transition to talking about that. Although I do want to go back to the stool test. Sorry, let me go back to the stool test for a second. So for listeners, I just want to break down again. The stool test is extremely important because, as Dr. Dan said, we get to see good bacteria, see if
Hmm.
you're low in good bacteria. If you're really high in good bacteria, you could have a condition called SIBO, which we won't go
Hmm.
into, but we've had other episodes where we've talked about that on. We can also look to see if you are low on enzymes, see if you need to
That's
take
great.
hydrochloric acid, digestive enzymes, ox bile. We can see how inflamed you are. We can see if you need
Right,
more fiber, more short chain fatty
right.
acids, and we can look for parasites, yeast, and bacterial overgrowth. So the stool test can tell so much. And so if you're
Right.
listening and you haven't had a stool test run, this may be a good next step for you with rebuilding your health. So I just had to put a plug in for stool testing. We haven't talked a lot about stool testing on the show yet. So
And I agree. Listen, January is
yeah,
coming up. Everybody's going to make the resolutions. Get some of the testing done.
yeah, yeah.
Get some of that testing done, and see where you're at, and see what that functional medicine
Hmm.
practitioner
Hmm.
can do to help you out. Right? I think that's important to do. It's
Yep,
your health. It's your health.
yep. Totally agree. And then I forgot where I was going to go. What was I saying before this?
We were talking about gut health, and what are some of
Oh
the
yeah, gut healing nutrients. So now let's transition. We kind of talked about what nutrients many patients are very low in, but specifically what are gut healing nutrients. So
right.
after doing food testing and stool testing, right, when we want to work to heal the gut, what nutrients do you use heavily?
I have a protocol where I have a nutrition shake that I recommend out of my office that has glutamine. Glutamine is great to help starting the process to heal, right? So glutamine, having a nutrition shake with glutamine, L-glutamine that's in it, vitamin D, okay? That is important too. That'll help start healing the gut. Anti-inflammatory effect gets right there into that gut, starts bringing all of that down. SPMs, the pro-resolving mediators, are
Mhm.
anti-inflammatory. Those are three right off the bat in combination with the very specific diet that I find really, really significantly helps out a lot. So probiotics, vitamin D, SPMs, and a nutrition shake with glutamine,
Sure.
L-glutamine, along with the diet. That is great. That is a home run as far as I'm concerned. Do you find that similar in your
Yeah, and in my book, in chapter 1, I kind of walk patients through the Institute for Functional Medicine gut healing protocol. So involving a lot of those supplements you just mentioned. I'd say zinc is up there. Also, zinc's
Zinc is
great
up
for
there.
wound healing. That's kind of in our shake, our gut. What do we call it? We have GI support and gut shield, two different kind of gut
Right.
healing products. And then turmeric. I do use a lot of turmeric, permitting they don't have a
Because that's
sensitivity
also another
to
great
turmeric.
anti-inflammatory, right?
Yep. And then antioxidants, and occasionally I'll use prebiotics. I'm pretty shy with using prebiotics unless I know they need them, just because I'm someone who has had SIBO, who fiber sets me off. And so, not
Right.
everybody, I'd say, needs that. I like to test to know what patients need. But yeah, I think
If you're
gut
not
healing.
testing, you're guessing.
Yep. Yep.
That's our motto in functional medicine in part. If you're not testing, you're guessing.
Totally
So
agreed. Yep.
yeah,
Yep.
if your doc is not testing and they're just kind of like going like
Piecemealing.
this, yeah, and seeing what happens. Ah, we'll see in a month. No, no, no. We want to make sure that you get the best care possible.
I want to talk a little bit more about kind of your weight loss, I guess, program strategy with your clients. Like, how do you feel about fad diets, and like how do you help patients? You've kind of already shared some of this, so I feel like we're kind of maybe repeating ourselves, but how do you help patients essentially with weight loss? Because so many of these patients have metabolic syndrome and they are overweight, and clearly you were as well, and you've lost a lot of that weight. So you
I
want to
lost
speak on?
about, yeah, sure. I lost about 70 pounds, 65, 70 pounds. Again, number one is getting that food sensitivity done to make sure that you're feeding your body
Sure.
properly. I'm not a calories in, calories out type of a guy. I don't like that. I mean, that's
Mm-hmm.
from, you know,
Ancient. Yeah.
yeah,
Yeah.
that's ancient. Because what happens with that fad diet that I call that is that once you calorically restrict yourself and you're working out, now you get rebound because now your relationship with food, and I think this is the important aspect of this, that relationship with food is still the same. So, okay, I'm going to eat a little fish, I'm going to have a little salad, and I'm going to do that. I'm not going to have a lot of it. You know, some of these popular weight loss programs out there do this. You can have a little lasagna, but it's calorically restricting you. And so when it's done, now you get rebound and you gain not only that weight back, but another 15 to 20 pounds because now you're just starving. So eating the appropriate foods is important. Doing physical activity is important with this also. You
Mm-hmm.
know, and listen, you know what? I recommend, I'm not a personal trainer or certified strength and conditioning specialist. I'm just a guy that's trained all of his life playing football and stuff. You know, a simple recommendation after dinner, walking out 15 to 20 minutes and coming back 15 to 20 minutes, building up some cardiovascular strength, doing some resistance training because muscle is important. It's been called the organ of longevity. You want to have high
Mm-hmm. Yeah.
lean protein, you want lean muscle mass, you want to bring down the percent body fat. And you know, one thing that we haven't mentioned so far is sleep. Because without restful restorative sleep, which you got to get rid of your stress during the day. You can't have your cup of coffee at 10 o'clock at night. Well, my father would have coffee at 1 o'clock in the morning and then he would just fall asleep. But that was a story for a different time. But 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 without restful restorative sleep, your biochemical functions are just not going to function, if you will. And so you need that restful restorative sleep in order to make that work. Eating the appropriate diet. And I find when I do the food sensitivity test, people actually eating more. It's kind of like their body wants those nutrients from those foods that they want. So eating the appropriate diet for you, doing some physical activity, sleep, water, managing stress. That's the way that you're going to help reduce that weight, that percent body
Sure.
fat, if you will, right?
Sure. I want to come back around to your story also, and this is a personal question, so I can always edit this out. But
That's
are
okay.
you?
Keep it in.
It sounds like initially you were put on medications because your cholesterol, triglycerides are very high. So flash forward, right, a couple decades here. Are you successfully off many medications?
I'm
How are your labs
successfully off of
now? Yeah, where
all
are you?
medications. I am successfully off of all medications. We do the blood work every 6 months.
Yep.
There are times when I do go on a statin for a period of time,
Sure.
and then my personal internist is also my partner, and she's a functional medicine doc. So we'll strategize, and maybe I'll go on it for a period of time. But it hasn't been like this for a decade. I'm very motivated. I'm very motivated to stay healthy. And you and I talk about, what is your why when you're dealing with somebody? I have a 14-year-old, and I'm going to be 61. He plays hockey at a high level. I want to be around for that.
Yeah.
I want to be around for grandchildren with that. He and I went for a run last night. He's beating me now when we're running. He can't bench as much as I can, though. So that's something that he's struggling with. He says, "Dad, you're pretty strong for an old guy." We'll see. So finding out that why is important,
Absolutely. Yep.
in order to stay motivated. So I'm not on any meds right now, not on any meds. I work out. I find I have exercising that I do that I love to help myself out. I just think that once you start this, getting off the meds, and if you're working with somebody such as yourself that can prescribe the meds, taking them off is a happy day. And let's go with it, because now everything's within normal, right? As we say.
Well, this was great, very motivating. So kind of tell us again where you're from, where listeners can find you, and tell us about your Discover Call, how patients can connect with you.
So I have I am in New Jersey. I'm licensed in a lot of states, so I see clients via telehealth in a lot of states. I have a discovery call, half an hour. I'll go over your blood work. I'll go over your lifestyle. I'll go over your diet. It's for free, to see if I can even help you. If I can help you, I'll tell you. If I can't help you, maybe I'll say, why don't you try this first? And then let's keep in touch, and let's talk in 3 months. So the discovery call is free, blood work, lifestyle, diet journal. I'll even do a pantry. I'll look at the pantry. They get their cell phone, and they'll walk around and say, all right, show me what's over here. What's that in the back? I'll say, what are you doing? What is that? No, I don't know if I like that. Open up your refrigerator. I'll take a look at that. A simple way to get me is 2 ways. Email is dancardellichio@gmail, CARD as in David, ELLICHIO@gmail. And you can call me directly, 917-608-5896. I'm always available to talk, to help out an individual.
Awesome. Awesome. As my listeners know, I wrap up every show with your top longevity tip. So what would yours be?
This is an interesting question, and it may be a little bit different than what other people have said, but my longevity tips, people may say, take the Mediterranean diet, do this, do this, do this. I'm going to say to your listeners, this is a personal responsibility, your longevity. Personal responsibility. It's not the responsibility of anybody else. You need to take your health in your own hands. This is something I'm really serious about. This is something I talk about a lot. We're coming out of stuff over the last 2 years. It is a personal responsibility to make sure that you are healthy. It's a personal responsibility to make sure that you can fight off things. It's a personal responsibility to make sure that your biochemistry, your cholesterol, your autoimmune, whatever that is for you, is taken care of. You need to be involved in your healthcare. You need to do every single day. It's just not a sometime thing. It's an all the time thing. I think that Lou Holtz or Vince Lombardi said that, winning's not a sometime thing. It's an all the time thing. You have to do this every single day of your life. Have a cheat meal every now and again, but personal responsibility to longevity is my mantra.
No one has said that. That was strong. That was great. Yeah.
Thank you.
So thank you so much today for coming on the show and sharing what too is my passion, functional medicine, and all the functional lab testing that we can offer patients, and how really that can save lives. So you're still setting the world on fire, just in a different way. So
that's right.
Thank you.
Thank you for having me on. Motivate, educate, and inspire. That's what we do. And I hope everybody has a great day. Thank you for having me on. Take care of your health.
Agreed. Mic drop.